Hello everybody, welcome back to my channel. My name is Pinky. Um, Today I'm going to discuss about premenstrual syndrome, PMS. Pre means beforehand, menstrual is like the period which women has once a month usually, and premenstrual syndrome means the signs and symptoms. Now premenstrual syndrome, I'm gonna follow the guideline. Usually I follow the guideline of England, and I go through the guideline basically, and I don't make anything by myself. And yes, I do try to stick to the guideline always, and obviously sometimes because of my experience I will give tips here and there. So premenstrual syndrome, it is hormone related, right? And it basically happens before you have your period, before the period is about to start, and it usually gets resolved when the period is about to end. So this is premenstrual syndrome. And basically there is no concrete evidence that why premenstrual syndrome happens in some women, but the basic idea is it's hormone related. It's related to hormones. So during the period there are some kind of hormones which increases in our body, and which brings about this symptoms of premenstrual syndrome. Now when these hormones rises, it also decreases the happy hormones in the body, and that's why the symptoms can be very much profound in some women. Now 40% of women will suffer from symptoms of premenstrual syndrome, but there will be women around like 5 to 8% who will suffer with severe premenstrual syndrome. Now, how will we diagnose women with premenstrual syndrome? Now, usually there are like physical symptoms, psychological symptoms, and the physical symptoms can be the joints will hurt, the joints of the body will hurt, and there will be muscle pain, there will be back pain, the breast will become tender, and sometimes the breast, there can be pain in the breast as well. Abdominal, like the abdomen will be like bloated, and there can be swelling in the abdomen, there can be headaches, skin reactions, and obviously we have pimples. Women during the period time or before the period is about to come, and there can be weight gain, swellings of the hands and the feet. And the psychological symptoms can be, some women they can overeat, and some women they won't eat at all. And the worst part is there can be mood swings. Mood swings is women will be happy sometimes, and they might like burst into tears. So it's like an up and down, rainy season and sunshine together. And so yeah, there the mood swings can be pretty bad. And sometimes there are women, they will just get very anxious, very angry, irritated, and they won't be able to sleep at night. There will be this restlessness, depression, they will be very sad, and pretty much that about the symptoms. Now while doing the diagnosis, it's very important for me to identify if there is any other causes of premenstrual syndrome, or is it there is an underlying condition like IBS, irritable bowel syndrome, which is associated with diarrhea and constipation together, and any other psychiatric underlying condition, ongoing condition or not. So I just need to separate the premenstrual syndrome and other underlying conditions. And so I usually advise my patients according, there is a recommendation that please do monitor your signs and symptoms for at least 2 cycles in a diary, which is very important. Now let's talk about the management of premenstrual syndrome. So the first and most important thing is the lifestyle. Lifestyle is the key. Exercise, half an hour every day at least, or some kind of activities for half an hour every day, which is very important. And then I would also like request patients do some yoga or reduce your stress. Don't drink, alcohol reduction, diet, don't go for like sugary stuff, cakes, biscuits, cut cakes, biscuits, and sugar containing foods. And with some patients the symptoms can be so profound that we can prescribe some combined oral contraceptive pills. Combined contraceptive pills, what it does is it regulates the hormones in the body. And sometimes what I tend to advise my patients that take the oral contraceptive pills without any gap for at least 3 months, and then go for a 4-day gap where the patient can have like a withdrawal bleeding. So take the oral combined contraceptive pill consecutively for 3 months, and then give a gap of 4 days. And there can be psychological therapies as well, like it's just like a cognitive behavioral therapy. And there can be complementary therapies as well, although there is not much evidence, but usually there are many patients who has got benefited from these complementary therapies. The complementary therapies are like evening primrose oil, vitamin B6, vitamin D, calcium, agnus cactus, magnesium, St. John's wort. Now, while taking any medication, it is very important to discuss with your healthcare professional if you are on any other medications which might have interactions with these complementary therapies. Okay, so before you take any medication, make sure you read the patient information leaflet, which is very important as well. There are also some other options for which we usually refer the patient to the hospital, that is the secondary care. And so in England we have two sections of care. One of them is the primary care, another one is the secondary care. So there is a in primary care where I work, like I work in a GP practice, so I got a certain limit, that this is my limit, right? For if I have advised patients, prescribed medications, and if still doesn't work, there's a limit, there's a cutoff point. After that, I'm gonna refer the patient to a specialist, that is the hospital. In hospital, basically, there can be gynecologists, and they can prescribe like transdermal hormonal patches, which is a patch which can be stuck on the arms or anywhere in the body. And there are like diuretics such as spironolactone is a tablet which also help, but these should always be prescribed by a specialist and not by general practitioner or pharmacist practitioner or nurse practitioners in primary care. And sometimes when lifestyle, after referring to the patient to the secondary care or any other medications, so doesn't work, then the last option is hysterectomy. So summarizing, premenstrual syndrome, it can be very bad in some women, and we all have families, right? And in our families we do have mom, sister, wife, there are like cousin, sisters. All the women should be taken care of when they're having their period. Their mood will fluctuate, and we need to understand that yes, the mood is fluctuating, and it is quite a stressful situation while having a period. So I will advise everybody that be cautious, please get concerned, and take care of your family members, and try to understand that yes, support is needed. Okay, so summarizing, obviously lifestyle. After lifestyle, if some patient is obviously very depressed, and they're very low all the time, and during this menstrual syndrome, there are like antidepressants like SSRIs, SNRIs. Antidepressants usually prescribed for premenstrual syndrome is citalopram 10 milligram or venlafaxine. All right, these medications needs to be taken continuously, and this helps to improve the mood, okay, uplift the mood. So if I want to summarize, as like, you know, how to manage premenstrual syndrome. So the first line is lifestyle. The second, for depression, go for like antidepressant tablets like citalopram, venlafaxine. Oral combined contraceptive pills can be used as well to control the hormone levels in the body, the cycles in the body, and obviously reduce the symptoms of premenstrual syndrome. After that, there is psychological therapies, there are complementary therapies, and there is, from secondary care, there are like transdermal patches, there is diuretics such as spironolactone, and obviously the last option will be hysterectomy. Now, if anybody has got any questions, please put it in the comment section below. And if anybody thinks, okay fine, I didn't understand what does this means, or if I have used any medical jargons accidentally, which I try not to, and if you are thinking, oh my god, what's that, please put in the comment section below. Thanks a lot for watching, and please let me know if you want me to do any other videos on any other topics. I try to cover the common topics usually. And yes, thank you so much, and obviously please do motivate me, encourage me, and how you're gonna do that. That can be done, like, you know, if you like and share my channel and like my videos, and subscribe. So yeah, pretty much that. Please do watch my videos, and thanks a lot for supporting me so much. It means a lot. And yeah, pretty much that. Thank you so much. Stay safe. Bye for now.